Welcome to an introductory webinar on the alternative payment model for primary care, also known as APM-1. My name is Zoe Pincus, and I will be walking you through the fundamental principles and concepts of the APM-1 program. The mission of the Department of Healthcare Policy and Financing is to improve healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. The APM is one part of how Hcpf fulfills this mission. The APM-1 program is part of the department's movement to value-based payment models and improving quality of care. This program seeks to accomplish three goals: provide long-term sustainable investments into primary care, reward performance for positive outcomes for primary care medical providers while also holding providers accountable, and align with other payment reform initiatives across the delivery system to bolster shared outcomes. In state fiscal year 2017-2018, the Colorado General Assembly authorized Hcpf through a budget request to invest over $50 million into primary care each year on the condition it be paid through a value-based payment structure. The per-year investment shifts slightly year to year based on appropriated reimbursement rates decided by the Joint Budget Committee. Most components of the program are the same for all PCMPs. However, there are a few important differences for the federally qualified health centers, and those differences are described throughout the APM guidebook. Historically, the pool of funds has been evenly distributed to all providers who participate as an enhanced rate to the Health First Colorado fee schedule. The intention all along was to change payments to reward higher performing providers by moving to a value-based system. Due to the COVID-19 pandemic, the department has held off on making this switch. However, for the first time, providers who participated in program year 2021 will see a payment rate change beyond or below the enhanced rate. The APM-1 program applies to all providers designated as a primary care medical provider, or PCMP, in the Accountable Care Collaborative, or ACC. To be eligible for the APM-1 program, PCMPs must have 500 or more attributed Health First Colorado members. In the APM, PCMPs report on 10 quality measures each year from the APM measure set. 3 are mandatory measures, and the remaining measures are selected by the PCMP. A PCMP will report on those measures and demonstrate performance in order to achieve 200 or more points to determine payment rate change for the practice the following year. We will walk through the timing of this cycle in a few moments. There are 3 types of measures in the APM-1 program. The first type is structural. Structural measures focus on a PCMP's capacity, systems, and processes to provide high quality care. An example of structural measures include integrating behavioral health care, providing alternative types of encounters, or implementing patient satisfaction processes. The second type is administrative. Administrative measures are calculated from state agency data for Health First Colorado members, such as the PCMP's processed Health First Colorado claims or the Colorado Immunization Information System. Administrative measures were formerly referred to as claims measures. Administrative measures indicate what a PCMP does to maintain or improve health, either for healthy people or for those diagnosed with a healthcare condition. Examples of administrative measures include child and adolescent well-care visits or screening for depression and documenting a follow-up plan. And the third type is electronic clinical quality measures, or ECQMs. ECQMs are directly from a PCMP's electronic medical record and reflect the impact of the healthcare system or intervention on the health status of a PCMP's patient panel. Per national measure specifications, ECQM denominators include all eligible patients, regardless of payer, that meet the measure criteria, which provides a view into how a PCMP is performing overall for all measures submitted. This includes baseline and program year measurements. Examples of ECQMs include diabetes, hemoglobin A1C poor control, or high blood pressure control. In general, ECQMs and administrative measures are worth more points in the APM than structural measures. The way providers earn points varies across the different measure types. Structural measures are evaluated on a pass-fail basis, so either full points or no points are awarded. Administrative measures and ECQM points are based on a close the gap calculation of 10% to demonstrate improvement between a PCMP's baseline performance and Hcpf's target goal for a measure. To earn full points for these two measure types, a PCMP must hit their own target goal for the measure. The target goal is unique for each PCMP based on their baseline performance. Currently, there are 30 measures in the APM program. By measure type, there are 11 structural measures, 8 administrative measures, and 4 ECQMs, and 7 measures exist as both ECQMs and administrative measures to provide flexibility in how PCMPs are able to report data. However, PCMPs are limited to selecting either the ECQM or the administrative measure version. There is a 180-point limit on the number of points a PCMP can earn from structural measures. PCMPs that report ECQMs will earn at least 25% of the reported ECQM point value, even if the measure denominator is 0, and/or the practice cannot demonstrate improved performance. The point structure for ECQMs is outlined in the APM guidebook. Starting this year, program year 2022, each PCMP must report on 3 mandatory measures selected by Hcpf that align with CMS child and adult core measure sets. A PCMP is allowed to choose the remaining measures. There are additional measures available as roll-in mandatory measures in the event a PCMP is unable to report on the other mandatory measures due to insufficient data. More details and information on the mandatory measures can be found in the APM guidebook. The APM program looks to ensure alignment with Medicaid core set focus areas, such as maternal and prenatal health, acute and chronic conditions, dental and oral health services, behavioral health, and experience of care with other value-based programs within the department, such as the Hospital Transformation Program, Key Performance Indicators, and Behavioral Health Incentive Program. Structural measure points are earned all or nothing, while points for administrative measures and ECQMs follow a close the gap calculation based on a statewide goal set by the department for each measure. To receive full points for a measure, PCMPs are expected to demonstrate improvement by closing the gap between their own baseline performance and the department's statewide goal by 10%. Thus, PCMPs are measured against their own historical baseline rather than against other practices during the same period. If a PCMP's performance is at or above the statewide goal, the practice will receive full points for that measure. In this example, the bar represents meeting 100% performance on a measure. The department goal for this measure was set at 70%. The practice's baseline performance is 40%. The gap between the baseline and goal is 30%. A 10% gap closure in this example would be improving by 3% or more from 40% to 43%. The practice must improve by 3% or more during the performance year to be rewarded full points for this measure. The points a PCMP earns for individual measures are summed to calculate the APM quality score. Each PCMP must earn an APM quality score of at least 200 points to receive the maximum enhanced rate. A maximum of 180 points can be earned from the structural measures, and PCMPs must demonstrate performance on administrative measures and/or ECQMs to earn the remaining 20 points. Currently, all PCMPs in the ACC are earning the maximum enhanced rate of 104% of the Health First Colorado fee schedule. Payment rate adjustments have not yet happened in the APM program. However, beginning in October, enhanced rates will be tied to APM quality score from program year 2021. Only PCMPs who participate in the APM are subject to the payment rate change based on performance. For PCMPs who earn 200 or more points, there's a possibility of earning greater than the 104% based on the performance of other PCMPs in the APM program. All PCMPs have been receiving the maximum enhanced rate for the last several years, but the APM payment model intends to provide more funds to top performers, like practices A and B in this example. Practices A and B will have an enhanced rate greater than 104%, Practice C will earn less than the 104% enhanced rate, but they are still above the baseline rate of 100%. And practice D will receive the baseline rate of 100%. Since practices C and D both earn less than the enhanced rate due to not earning 200 points, there are extra funds to be redistributed to practices A and B. Here's another view of the same example. This shows that currently the primary care investment is distributed evenly to the 4 providers. Everyone gets an equitable slice of the pie. The intention of the program is to redistribute the pool of funds based on performance in the APM. Since practice D earns 0 points, they would not earn a slice of the pie. Practices A and B would earn more of that pie based on being higher performers than practice C. Engaging our community of stakeholders has been an important aspect of the APM program each year. Hcpf has 3 community forums planned over the next few months to discuss any program changes and updates for program year 2023. The forums are open to the public, and we encourage participation from primary care medical providers taking part in APM 1, as well as all Colorado stakeholders with an interest in investments in primary care, performance and accountability, and Hcpf plans for value-based payment reform. You will need to register for each session separately, and the links to register can be found on the APM website under stakeholder engagement. The series will take place in 3 sessions that will build on each other, so attendance at all 3 sessions is recommended, and you will need to register separately for each session. If you have any questions regarding the APM 1 program, please reach out to Hcpf_primary care payment reform at state.co.us. Thank you.